Procedure Montel calls a miracle.
This man has changed my life.
It's a week of living well. That's what's coming up right now. I'm not certain because I haven't done the scientific research on it to know if this can work for everybody else out there. But I'm going to tell you, I suffer from MS. I have extreme neuralgic pain in my lower extremities. I'm in pain 24 hours a day, 7 days a week, 365 days a year. And then I go to see this doctor. I've had pain in my feet. I've struggled with my balance. So Dr. Erica sent me to see a man who I will tell you now 12 days ago. And there's not a person who knows me who will not confirm this if you just ask them. Everybody who sees me, I am walking differently. My pain is less. I have already regained strength in my left leg. My left leg has dropped because I found out that my pelvis was tilted. It's dropped back down. They are now the same length. It's the most amazing thing that's ever happened to me. Take a look at this.
Atlas Orthogonal is a specialized chiropractic program which utilizes an instrument to gently realign the atlas vertebra into proper position to rebalance the entire spine. The atlas is the first bone in the spine, and they call it the atlas because of Greek mythology, Atlas holding the world on its shoulders. And your atlas basically holds your world on its shoulders. Okay, Montel, come on up, phone.
Yes, sir.
Okay, so what we're doing is examining Montel for the C1 and C2 nerve root compression. These are nerves located right at the base of the skull. When you have a misalignment, as the head deviates on the first bone in the neck, it mechanically compresses the nerve roots at the base of the skull, and that causes you a lot of dysfunction. We've taken x-rays of Montel. The atlas has shifted up, and that compresses a very important area in his nervous system, the brainstem area. What we want to do is gently realign the head back over the neck so we can have proper transmission between his brain and his body. The instrument looks a little scary, but it's actually very, very non-invasive, and the patient doesn't feel it. So when you sit the patient back up, you can already feel instantaneously less pressure on the nerves at the base of the skull. If we can gently realign the head on top of the atlas, the body automatically starts to respond.
But it's so simple.
Please welcome Dr. Kerr to the show.
Yay! Yay! Dr. Kerr! Hello, baby. He's the first one who says hello to you first.
Have a seat, sir. Have a seat, have a seat, have a seat. Why don't you tell them what you did exactly? See, you're using all the big terms about C1, C1, but my head, see, everybody knows that my head was screwed on wrong.
No, they didn't.
Yeah, well, they thought they was. But you basically screwed my head back on right, correct?
Exactly. What we do in Atlas Orthogonals, we take specific pictures from the side, from the front, and from the top of how the head sits on the first bone in the neck. And we use a specially designed instrument. It's a percussion instrument. It looks kind of crazy, but it's a specially designed instrument that gently slides the atlas and the cervical spine back up underneath the head.
And this is, for me, it was almost an instantaneous relief of some of the pain that I have in my lower body. But I was surprised that there was no pain involved. I will tell you, though, now, this is an odd one. I felt weird. You said that this was happening. I've been weird. Everything, like once it's almost as if, for the first time, I can stand straight in the last 5 years. For, and most of you don't see me, but when even on air, you'll see me in a couple of the old shows. I normally stood up when I'm talking, and I can't stand still. The reason why is because my feet hurt so bad that I'm trying to lessen the pain on one foot or the other. Plus, my balance was off because my leg was shorter, and so I was standing like this to try to let people not see me do like this, because that's really how I've been positioned for 6 years. I was a boxer for a period of time. I was a martial artist for a long period of time. I played football when I was in school. One of the biggest injuries that most men are walking around with who play football is probably this. Your head's off because you've been crashing heads and banging heads. If you ever participated in sports that were rugged sports where you fell off of something, hit your head, had a concussion, anything like that, chances are, look at this, chances are, that's just from a blow one person to another football-wise. Think about all the little boys that are playing Pop Warner football. Think about all the little kids that are playing in martial arts classes, and instructors allow them to take a kick to the head. That blow to the head, though it may not knock him out, may not knock him down, may have shifted.
But you know what else? What about women, the aerobics that we do? How about just a little motor vehicle accident? Anything, any kind of trauma. Look at the neck, how thin it is, how little it is, and how heavy a piece of brain it supports.
Right, your head weighs, what, 15 pounds?
Well, when you think about it, it's really very complicated, the head and the neck. Because if you were going to design the body, you wouldn't put what controls your body way out in this sphere and have this little pathway to control it.
And now, GMA on call. Millions of Americans take medication to lower their blood pressure, but new research suggests there may be a better solution. The idea is that some people may be able to toss their pills and visit a chiropractor instead. So how would it work? And is this method right for everyone? 1 in 3 adults suffer from high blood pressure. Nobody can say for sure what makes it rise, but now a new medical study is cautiously suggesting an unusual way to bring it down. Realign the spine.
When the spine is misaligned, it can affect all types of things, all types of diseases, conditions.
The idea is that the C1 vertebra, located at the top of the spine, operates like a fuse box in the body. When twisted, it can pinch arteries and nerves at the base of the neck, not only causing discomfort, but affecting blood flow too. Denise Neiman suffered from neck pain.
Your upper body's off to the left 2 degrees and your
X-ray showed her C1 out of alignment. A special chiropractic adjustment lowered the pain and her blood pressure at the same time.
My blood pressure dropped tremendously.
Could there be a connection?
We designed a double-blind study to really look and see if, in fact, this procedure was affecting blood pressure.
25 patients got the special adjustment, 25 others a fake one. The ones who got the real thing saw their blood pressure drop an average of 17 points, a dip that usually takes 2 blood pressure medications to achieve.
So it's pretty significant.
But before you run out and get your neck adjusted, you should know that only a handful of chiropractors are qualified to do this kind of thing. The study is still being reviewed, and though blood pressure was still down 8 weeks later, nobody can say for sure how long the adjustments will last. And we want to thank our fabulous Chicago station, WLS, for all their help on this story. Now, for more on the possible connection between your spine and your blood pressure, our medical editor, Dr. Tim Johnson, joins us now from Boston. So, Tim, what do you think of this study?
Well, it's obviously very intriguing, the idea that a simple manipulation of the neck might result in a very significant lowering of blood pressure. There are obvious limitations to the study. Only 50 patients, only 25 treated, only 8-week follow-up, a very special kind of chiropractor training required, but it certainly is intriguing and deserves further study, and in fact, a larger study is now underway.
And so tell us how, in theory, how does this work, realigning the neck, the spine?
Well, the truth is we really don't know, but that vertebra at the top of the neck is in a very critical area where the brain stem, the lower part of the brain, is involved with the regulation of blood pressure. So it's theoretically imaginable that changing the anatomy of that area might have some effect on the regulation of blood pressure.
So people at home are, starting to feel around the back of their neck right now saying, so how do you know if it's in alignment?
Well, aside from having pain that might bring you to a doctor or to a chiropractor, you really wouldn't know unless you get an x-ray. And so the intriguing question, with further study that verifies that this might be a possibility, will be how do we suggest which people go and get their necks x-rayed and maybe have this kind of manipulation? There's a lot to sort out, but I'm telling you, the medical world will pay attention to this because of the very significant drop in blood pressure, and eventually I think we'll sort out which people should go and have their necks x-rayed.
Well, that's huge, because I was automatically, when I heard about this yesterday, my mother has battled with high blood pressure, and I know that she has a little bit of curvature in the spine, and wanting to know, of course, she's 84, so you have to know if this is right for each particular person, and also how long does it actually last? Or you can just toss the pills, or do you have to do it ever so often?
See, we don't know that. These people had just one manipulation, and 8 weeks later, their pressure was still down. How long that will last is what will be required for further study. So a lot of unanswered questions, but I'm telling you, this catches our attention because of the significant drop in blood pressure. It absolutely deserves more study.